This government meeting is brought to you by Eastworks and our local cable subscribers.
Do you want to kick us off, Dan, with the agenda?
Approval of the July minutes, they were sent out, I'll make a motion to approve.
Oh, we have to do voice attendance.
We have to do attendance?
We have to do voice attendance for the secretary. It's our accessibility method for the secretary. Hi, Patrick.
Oh, Pat's here.
Just a roll call, like.
Yeah.
Hi.
Yep.
Okay, for attendance,
Tom Brown.
Cynthia Terrell.
Leslie Button, Sandy Eddy, Don Gratian Moore.
Dan Rist,
Pat Bruff.
motion to approve the July minutes, somebody make the motion.
You did.
I can make it again.
I'll second it.
The discussion. Hearing none, we have to do a voice vote because Pat's on. Tom Brown,
Aye.
Cynthia Terrell, aye.
Leslie,
Leslie Button, aye.
Aye.
Sandy. I wasn't here, so
abstained.
abstain.
Dan Rist, aye.
Pat Bruff, aye.
Public speak, there's no public that I can see. So we're talking about the data collection. I'm gonna hand it over to Cindy. She has some information for us.
Kathy is coming late, otherwise she could also present this. So our assignment was, if you recall, let's figure out the best use of spending the $9,800 for this committee, and not saying that we have to spend it all, but just, and how can we collect information from the people who use the center, work at the center, volunteer at the center, to go into the report. We thought that would logically be a survey, and people are just going to be so bored of me saying this over and over, a survey and facilitated discussions. We scaled back from doing a big community-wide discussion, thinking that would be more appropriate for the building committee to do once they're appointed. Now the choice before us is, do we scale back from doing the survey? And I will explain why the Kathy and I, as the remaining people of the survey committee who were around for the discussion, why we think we should hang back from the survey and pause on the survey, and that the part that should go into the report is getting the feedback still, but getting the feedback through facilitated group meetings, getting demographic data from UMass, and then also using the information we've already collected about what participants want, which we do have some, and how the information that was collected about what the staff think the needs are when we did that other building feasibility study with the architects. So yes, you're already interrupting me.
No, I'm asking a question.
Hi, Tom.
The facilitated discussions you're talking about, who's running? Are those with professionals? Are those with?
So that would be the professionally, so the survey and or professionally facilitated stakeholder sessions that are then reported on by the professionals who are collating the data and reporting it back to us and Crystal. And there's Kathy. Okay, so good timing for Crystal and Kathy to come on board. So I'm explaining, let me just go back real quick at the risk of being boring. So we have before us more choices to make for the committee to make, because after we talked to Pioneer Valley Planning Commission and then we talked to UMass a couple of times, Kathy and I talked, and here's the deal. In 2018, we did a community-wide survey of older people's needs in Easthampton. It's out of date and it doesn't focus on a new senior center. UMass did that. The very people that we spoke with, that department did it. Now they're doing surveys just like that and as it's a whole study, not just a survey around the state, focusing partly on new buildings. That's the trend right now. When you're doing a big needs assessment, also focus on, do you need a new building and what would that get your community? So since the 2018 one is out of date, since doing even the survey we presented you and being able to analyze the data and make something of it and not ask too many questions, ask the right number of questions, is actually a little bit more complex than just me and my staff can handle or that volunteers can handle to do well. Given that once a building committee is appointed, they're going to be doing investigating in the community. We thought, and this is what UMass was advising, hold off on doing that survey until you can do it and do it well. Do it so that it updates the 2018 survey and serves the purpose of finding out what people would want in a new center if they want a new center. And it's going to cost more money to do it well than what we have here. They really liked the idea of doing the facilitated groups with the stakeholders, and they could do that piece. We already have the questions written up. They're on the survey and they have the questions. They've been going around and asking around the state, and chime in if I missed something, Kathy.
Question. Facilitated groups. Is that in person or is that because you have a group list, say emails that you would use, they would use that as a way of communicating with these groups?
It could be anything. It could be virtual, hybrid, in person, small group, larger group, but it's the people. But before we get to the target audience, just
Well, my concern was only how they were gonna.
how they were gonna, right, it's through the COA. So we would, just the same way we would put out the survey, we have the mailing list.
Okay.
So they made a proposal. The proposal,
They,
the UMass, the department that did our 2018 needs assessment. They made a proposal which was, we could do part one now. Oh, also, neither of those groups, PVPC or UMass, could really do the survey in our time frame. So
You mean the big one?
yeah, the one we were gonna do. So UMass was saying, if you do part one with us, then we could do part two, the rest of, the needs assessment pretty easily whenever you're ready. And we wouldn't charge you the whole amount for that because you would already have done part one with us. They have not raised their prices since 2018. Back then it was 30 to 35,000. That's what we paid last time. It's still that price. So for under 10,000, they could do the first piece, which let me get into that. And then the second piece would be 20,000. Whenever the building committee is ready, has more funds, they could work. So the bigger site feasibility and design feasibility studying that's going on, we could do a needs assessment that would serve both the Council on Aging in terms of what are the needs of older adults in Easthampton and what are the needs in terms of a new building, as I understand it.
matching that up.
Then I went back to Pioneer Valley Planning Commission and I said, what if we just asked you folks to do facilitated stakeholder groups to get information? What would you charge? But I haven't heard back. But also it would be different because it wouldn't be part of the bigger project. It's not apples and apples. It wouldn't be done by the people who already did this project with us and know us, et cetera. But I'm waiting for them to get back to me, but I can't wait for, forever. And so we're going to talk about the target groups. That was your question. And we're also going to talk about what would we get out of it. So, the other reason, when they heard from Kathy and I the list of all the work this committee has done, and then the work we did with the architect before, the building feasibility study on the current senior center and the issues it brought up, and then all the demographic data they have at their fingertips about Easthampton and older adults, they said, as far as we're concerned, the information you've already gathered is plenty for your report to your community. But the state direct primary source information of asking people directly, like we're going to do either in a survey or stakeholder groups, they call that the icing on the cake. So it's good that we're doing it, but today we can sit down and write a report.
So those parts that you just identified that they've said we already have, who has the expertise to put that together in a formal report?
There you go.
Hopefully you weren't pointing at me, but
That's where we could have a small group, whether it's just me and Kathy or whoever, more staff, meet with them to digest the results of these facilitated sessions, take all the information that we've gathered, take their demographic data, and I will double check with them, but I think that we can have a meeting with them to help guide us in writing it. But, so what they say is, so the larger project, if we want to do the community survey and key informant interviews, which is like, you know, the other part of that, that wouldn't be able to start till spring 2025. But also, if the building committee is going to do more work that costs more money anyway, they're going to have to go for an appropriation, and it would take time just to do that. So they wanted to know if we today decide, no, we've got to have a survey this fall online, not just groups, then we need to let them know that right away. But they really feel that it would be worth our money to hold off and do something a little more comprehensive might be appropriate. So they would conduct some community forums. By community, they mean the community that's using and working at the senior center. We're not talking the whole community.
The current stakeholder.
Provide written notes about what we heard, provide additional data about peer communities to complement the efforts the ad hoc committee has already done, and provide some demographic data about the community. So the part that's not in here is, would they at all help us with writing the report?
and that's what they're able to do for under 10.
That's what they would do with, quote, within the $9,800 budget.
And then what do you have for funds for this paid facilitator for these discussion groups?
That's in that.
Oh, that's in there.
They
Yes,
would
they do.
facilitate, they do that.
Perfect.
The nice thing about UMass, and we should wait to hear from Pioneer Valley, but they have work with several communities and councils of aging. So they have a niche in this area,
Right.
and they did our report in 2018. So they kind of have an idea.
Yeah, I don't think it's a bad thing to piggyback the fact that they did the report in 18 and now they're going to do something in 24 or 25 for us or the building committee. I think that's kind of it just feels like a nice flow to the whole thing.
Yes.
And because it's 9,800, we can just decide to have them do it. We don't have to wait for Pioneer Valley because it doesn't have to be
Right.
bid.
It's not.
That's the reason it's $9,800. If it was 10,100, we'd have to bid the project. So I certainly like this. I just want to tell you, and UMass has my vote because they already did one. And I think the only clarification is let them help write the report. Right? We're not expert at that, and the report has to have enough data, not be too preachy, to influence
Right.
the building committee, or we're wasting our time.
Right.
We don't want them to start over. We've done this work.
Right.
We spent this money. Listen to us. We think we know, and a lot of you are already in, our stakeholders already in the senior center, so.
Dawn had a question.
I think it makes a lot of sense also from the perspective of survey fatigue and getting as many people to participate if possible. If we're thinking the building committee may want to do this in the spring, I think there could be a lot of people who are like, I just did all this stuff in the fall. You didn't do anything and now you're asking for more. That's not necessarily accurate, but I think that I would rather do a broader, really comprehensive survey when we're ready to get going and ask people and do the work of really getting as many people to participate in that as possible.
And I think I'm piggybacking on Dan's point, but at the end of the day, if this report has our names on it, that's nice. But if it also has UMass's name on it, it lends a sense of additional credibility to that report. It's not just these 10 people from Easthampton that thought this was a nice report. UMass is blessing this report, if you will. And I just made one note, Cindy, when you were talking about, I think it's important for us to do work that is of value to the building committee that they don't have to repeat.
Exactly.
Do work for them that they don't have to
We
repeat.
want our work to influence the building committee to the point where, well, they already did that.
Right.
Site selection,
Right.
and what facilities we want.
Right.
Peer community observation, all of that. And what this report is doing, I don't know if they'll make a recommendation as much as give the data.
The data.
It's all about the data.
Right.
You know, how many people live in Easthampton who might use this facility?
That's stuff you can't argue with. You can't argue with data.
It's, well, you can, depending on who you are. Sorry, that was
Right. But just like we have,
inappropriate aside.
I'm sorry, I should raise my hand.
No.
But just like we have the data from the building feasibility study we did with the architect that conclusively shows, you know, you fill your activities in the current building, there's no place for people to park.
Right.
There's the lack of accessibility, like all those things are data that can go into this as well, and we already have that written down. But Crystal, you were a proponent of doing a survey, you know, so we can get that primary source information from the users. I just want to make sure that you are cool with waiting to do a survey.
Absolutely.
We don't have your voice.
Yeah.
Oh, let me try to turn it up,
No, I think it's us. Turn it up.
which is the volume. Is it the plus minus?
Just yell, Crystal.
Can you hear me now?
Yes.
Yeah.
I'm in agreement with having the UMass do the survey because I think it's better to get it done comprehensively than to kind of only do what we can now.
Yeah.
And if we deal with stakeholders, if I understand what a stakeholder is, the people that are using the facility now, people you have communication with, staff that are in there, all of us. I mean, if that is part of their survey,
Right.
I think it accurately will tell the building committee that people who use it now would like this, are recommending this. So,
When they say key informant interviews, now I wasn't here for the last needs assessment, but what that I think means is then you're talking about, let's interview everybody at City Hall and Public Safety. Let's interview business leaders. Let's interview the chamber. Let's interview the
they're gonna do that
doctors.
now.
No, I'm saying, because they're saying the next phase would be community
phase.
survey and key
Okay.
informant interviews. And I just wanted to clarify that, yes, those people do partner with us, but there might not be time to do stakeholder interviews with those extended stakeholders, so to speak. That would be like the next phase.
And you told me, I think, on the phone that this has to be decided right away.
Yes.
Because we
like
have a
today.
deadline of January 1st. And we're gonna wanna go over this report, maybe edit it, and so we're gonna have this started immediately if we're gonna get it done.
How much time has Pioneer Valley had with this to respond to?
Plenty.
I
Yeah.
think you go with UMass. then.
Yeah, well, Cindy called me and said, I said she could make that decision because she's the head of the department. But since UMass was willing to wait, we wanted to have a
Yeah.
vote on it.
Yeah.
Yeah.
And I certainly feel more comfortable with that, so.
Yeah.
I'd make a motion that we do what Cindy said. Because I
Hire
can't,
UMass to do a,
because I can't repeat it all.
Well,
You have that, Louise?
Leslie.
That's on the record, right? Oh, God.
let's start the motion over. What is
Okay.
this gonna be called, the UMass?
Okay, so it
Or-
is. Okay. I would call it,
Hire UMass to conduct
I
community
would call-
forums.
Council on Aging forums. Council on Aging forums for the ad hoc building committee. I think that,
No, we
or,
wanna make a motion to hire UMass to do.
oh, sorry. What would the motion be called?
Yes. that's all.
Oh, the motion would be called, so could the committee make a motion to, spend up to $9,800 to contract with UMass for, data for the report?
I'll make that motion.
I make a motion what Cindy just said.
And Leslie, you have it on.
Yeah, so it's make a motion that we spend up to $9,800 to contract with UMass Amherst to conduct facilitated program data analysis. UMass Boston? Oh,
Gerontology Institute, blah, blah, blah. Yeah.
that
I need
makes
a
sense.
second.
I'll second that.
If we have
Or
a
go
second
ahead.
discussion. The only discussion I have is they sent us a bill for $9,800. Do we have any need for any of that money for anything? Any mailings, anything? No. So $9,800, you're okay with that? All right. I just wanted to make sure because I have no idea.
Only other discussion I have is, while we didn't itemize it in the motion, it included other things like potentially assisting with the final report, stuff like that. So that's all would be included in the contract, if you will, with UMass.
So what I would ask, oh, sorry.
I was gonna say we leave that to Cindy to contract and you'll include what the.
All the specifics.
All discussing.
Specific.
I'll include the most that I can get.
Right.
That's
So-
good.
So the minimum is conduct some community forums, provide written notes about what UMass heard, provide additional data about peer communities to complement the efforts the ad hoc committee has already done, provide some demographic data about the community and a project proposal for a larger project that would include a community survey and key informant interviews. And I would be asking them also to what extent can they help actually write the report?
Perfect. You get all that in there when you get a contract with them.
And just for clarity, this is the Center for Social and Demographic Research on Aging at the Gerontology Institute at the University of Mass Boston.
Okay, and you can put all that in the minutes because that will satisfy what the motion entails. Any other discussion from anybody?
This is kind of a phase one.
Right.
Phase two would be like in the spring.
Pat, you okay? Okay, so then we'll have a vote. Mr. Brown?
Aye.
Cindy?
Aye.
Leslie?
Aye.
Andy?
Aye.
I
Kathy?
skipped it.
Crystal?
Aye.
Pat?
Aye.
Dan says aye.
Perfect.
Motion is unanimous.
Thanks, everybody, for your patience. I know it took a long time to come to this, and I wish I had realized it sooner, that understood that this is,
I guess one other piece of that, it didn't have to be part of the motion, but you're gonna go ahead and notify UMass and move forward with them
today.
today. Perfect.
Okay, so now we're supposed to go into a site selection option and
There you go.
to consider purchase, exchange, and lease of value of real estate, and we're going to go into executive session. So the motion that needs to be made is to go into executive session to consider the purchase, exchange, and lease value of real estate. And that the open meeting will have a detrimental effect on negotiating position of this public body. And part of the motion will be it will not be recorded. And that the committee will not reconvene afterwards. Correct? So that is the motion.
And then the public has to absent themselves as well.
Yes.
We have to remove the public. So unfortunately, Louise, you would have to be excluded from this executive session.
And the
So that's the motion.
minutes will be released when it's been resolved.
Yes, but that's typical. You don't have to put that.
It's okay, I know that.
Okay. So let me call the roll. Dan Riss says yes. Tom Brown?
Yes.
Stella here?
No.
Chuck isn't here. Pat?
Yes.
Dawn?
Yes.
Leslie?
Yes.
Cindy?
Yes.
Crystal?
Yes.
Sandy,
Yes.
Kathy.
Yes.
Motion is carried. We are now in executive session.
This government meeting is brought to you by Eastworks and our local cable subscribers.